Hi everyone, Dr. Nemechek here with another week in review where I go over some cases that have some unique features to them. Just a pointer to hit the subscribe button so that you can stay abreast of all of our new postings as they roll out. So the first we got here is actually one of my favorite patients. He's an 81-year-old male. He started here in November 2013. It's severe combat-related PTSD from his time in Vietnam. He was having intense anxiety, flashbacks, nightmares, depression, lapses into alcoholism, some intermittent suicidal ideation, and on top of all that emotional stuff, just kind of frequent lightheaded, can focus, headaches, even kind of fatigue. So back 2013, we started him on intermittent rifaximin. This was before my kind of more understanding that I need to put most people on continuous when they have this kind of depth of problem. Anyhow, put him on 10 days of rifaximin to get a course of that. It's a fish oil olive oil vagal stimulator. The autonomics started improving fairly quickly. Lightheadedness, headaches, fatigue all improved. The anxiety improves a little, flashbacks improve a little. And so there, after a few years, I decided let's just bump him all the way up to the continuous rifaximin, which is twice a day nonstop. Fairly short order. The nightmares, the anxiety, all that completely stopped. He ended up having COVID a couple years ago, so we got a whole course of glutamine after that. And today I saw him. He's still on his continuous rifaximin, fish oil, olive oil, vagal stimulation. He's 81 now. PTSD is pretty much all gone. He's not needing any antidepressants or anti-anxiety medicines or anything anymore. Still some suicidal thoughts about what he went through, and especially it seems to be being churned up by some of the present-day political stuff going on, but he has a very good support system amongst some other veterans and family members, and his wife is just awesome. And energy, cognition are really good for his age. So a real nice case, and I'm just blessed we've been able to help him. Here's a 9-year-old boy. Starts back a number of years ago, so that's 6 years ago. When he's 3, kind of higher functioning, mom, I had my, in quotes, high functioning ASD. So he had autism, some speech delay, stims, but still was not horribly off. And we put him on the basic inulin-based protocol. We started getting some improvements with that. Awareness is better, stimming, lessons, language is better. And then after a while, in my notes, the language kind of just stopped progressing. So we went from, this is 5 years ago, inulin to 10 days a month of rifaximin. That didn't seem to help. We added in the vagal stimulator. That didn't seem to help. And so we banged that for, it looks like about 7 months. And then we went from monthly to continuous rifaximin, and boom, language, stimming start to improve again. And he basically caught up to his peers over the years that he was on that, doing great. And then once we get up to this point where they're like, all the therapists are gone, there's no IEP, everybody's signing off saying he's up with his peers and the parents are very comfortable, we try to then start backing off on the rifaximin. And so we went from, this was just this past June, continuous down to just 10 days a month of rifaximin. I'll do that first for a couple cycles and see if it holds them, and then we can go to intermittent rifaximin maybe after that. And it didn't work this time. That's the point here, is after 2 months they said he just wasn't so sharp, he wasn't responding quickly, he's a little more irritable, even at times kind of aggressive. And so we put him back on the continuous fish oil, olive oil, and his VNS. I should add, when we shifted from continuous to monthly, he was still on fish oil, olive oil, and VNS. It was just a change of rifaximin only there. And within a few weeks of restarting that, he was back to normal again. So our plan is we're going to keep him on the continuous for maybe another 6 months. We'll try it again, it doesn't work, we'll go another 6 months, we'll try it again. And what I find is we will get to a point where we'll go to monthly. He's not going to relapse any, and then pretty soon we'll be able to just keep him on his fish oil and olive oil. And even I can usually get him off the VNS, and he won't need that. That'll be the next step. But and he'll do fine after that. He'll just be on maintenance of fish oil, olive oil, and an occasional round of rifaximin if he starts acting a little funny. Here's a gentleman. He's only been here about a year. 67-year-old male. Started here about a year ago. Main thing was chronic kidney disease. So GFR, okay, normal's 100 above. They really want you at a minimum above 60. Here's 23. So the lower this is, this number, the worse your kidney functions are. Once you're down below 20, they're starting to talk about, like, when we get to 10, you're going to get either a kidney transplant or go on dialysis, okay? And he was also pre-diabetic. This is a blood sugar test. Normal is 5.6 or below. Diabetes is 6.4. So he's in the pre-diabetic range, had high blood pressure, and these rapid heart rates he needed a medication for. So we put him on continuous rifaximin, fish oil, olive oil, vagal stimulator. He got a course of twice daily glutamine for good measure, just in case he was also having some COVID enteropathy. And within several months, the tachycardia and the blood pressure normalizes, and so his medicines were metoprolol and lisinopril. Cardiologist said, you don't need these. Cardiologist stops them, and his kidney function, look, goes from 23 up to 31 in just 4 months. Okay, so here we saw him today after a year. He was 23, went to 34, 31. He's now at 43, and his diabetes range has dropped from the original 6 pre-diabetic range down to a non-diabetic range. So, doing great. Plan is to keep him on continuous rifaximin for a while. We want to drive up that kidney number further before we decide on shifting him to intermittent rifaximin. And then finally, 13-year-old child. We're having this is representing some of the problems we're having right now. Really good history. So, starts 5 years ago, autism, poor response, fearful. He's on the inulin-based protocol, starting to do well with that, adding more words. He got COVID. We gave him some glutamine. That didn't seem to help. And then at that point, we switched out the inulin for continuous. COVID can do 2 things to you. It can damage your gut directly, and so you need glutamine to fix COVID leaky gut. And then at times, it can cause inulin failure, to where inulin that was working, controlling SIBO before, now doesn't work. And I think it was the latter that happened here with him. And so we switched him to continuous fish oil, olive oil, and we kept the glutamine on board. And he starts improving again. And you learn to read, write, math, speaking sentences, socializing, things like that. Doing good. A lot of progress, and then they run out of rifaximin because of the sudden change in the tariff policy. So there was a thing called the de minimis exception, which allowed people to import things under the value of $800 and would not be subjected to duty, customs, or tariffs in the United States. So when their family was getting their rifaximin through a Canadian mail order pharmacy, suddenly that was prone to tariffs. I think the Canadian mail order pharmacies didn't know how to handle that all of a sudden, because it came rather quickly at the end of August. It was announced. So the supply chain stopped and they ran out, basically. And within about 2 or 3 weeks off the rifaximin, marked decline in awareness and responsiveness. He was just getting all cloudy again, anxiety, fear, some of his little sibs. He wasn't as bad, but he was gesturing when he was getting frustrated again. And so it's hard to know what to do here. We put him on a twice daily inulin PHGG, so this is partially hydrogenated guar gum. So he'll get some of each of those in the morning, some of each of those in the evening. I have no idea if this will help, quite honestly. But we're just trying to do something, because from what we're seeing now at the time of this recording, the Canadian mail order pharmacies are starting to ship again. They've got like a huge backlog, so he may be off for another month or two, and then I'm feeling confident he'll be back on. And once we do, he'll just pick right back up, and within a few months he'll be back where he left off. So anyhow, that's all for today. Everybody, thank you for being part of this. Hit subscribe to get our next videos when they come up. Remember, take care of your kids, take care of yourselves, keep your inflammation down, and take care. This is Dr. Nemechek. Bye.